lovely government shutdown.
A last-minute attempt to pass a funding plan. The White House Budget Office sending a memo to federal agencies to start executing their plans for an orderly shutdown. In a new report, the Congressional Budget Office estimating the shutdown will lead to the furlough of about 750,000 federal employees. Workers got a memo earlier telling them of a possible furlough, and that memo included a message putting the blame on Democrats. Republicans push for averting a shutdown by passing what's known as a clean continuing resolution. That CR, though, already passed the House and would have kept the government funded at current levels for a few more weeks while the negotiations continued. But Democrats say they are trying to prevent a looming health care crisis. They're calling for Medicaid cuts to be rolled back and for Obamacare subsidies to be extended. Both parties now pointing the finger of blame.
24 pages long, funds the government till November the 21st, at which time you have the same leverage then that you have right now, and we have until the end of the year to fix the ACA credit issue. And we're happy, as I said yesterday and have said on multiple occasions, to sit down with you to do that.
Leader Thune did not come once to me and say, is this bill acceptable? What do you want in the bill? So they call it clean. We call it extremely partisan. Not one discussion, House or Senate, between the two leaders. That is not how you negotiate.
Just to jump in real quick, I think regardless of what side is what, but him saying that, oh, they didn't come to negotiate, like, you guys work for us? Who cares what you want to negotiate? You should want to negotiate the best thing for us.
Millions of Americans will feel the impact of this shutdown. Paychecks will be stopped for more than 2 million federal employees, but essential workers, including TSA staff and air traffic controllers, will be expected to continue working with no pay. And there will also likely be pauses to public services, including access to public parks, as well as museums. The federal government is required to provide back pay once the government is funded again, but federal contractors are not compensated for that missed time. The last shutdown was during President Trump's first term. That shutdown lasted 34 days and was the longest in history. This time, President Trump is threatening to make cuts permanent.
We can do things during the shutdown that are irreversible, that are bad for them and irreversible by them, like cutting vast numbers of people out, cutting things that they like, cutting programs that they like. Because of the shutdown, we can do things medically and other ways, including benefits. We can cut large numbers of people out. We don't want to do that, but we don't want fraud, waste, and abuse. And, we're cutting that.
Not clear who's going to blink first. Now let's get to Capitol Hill correspondent Julie Sirkin for more on this. So, Julie, what happens now?
Trump's not going to blink. And the last time we had a shutdown, it was 34 days, which is a long time for government workers, like they said, 2 million of them, to not receive a paycheck. I don't know very many people who have more than 2 weeks, maybe a month. And I shouldn't say I don't know I know some people who do, but I'm just saying I don't think that there are very many people who have a month, 2 months worth of savings that will cover all their bills. So it's really going to get interesting, specifically now, because we're in a time where it just seems like there's no bipartisanship, regardless of who you voted for or didn't vote for. Both sides just seem like they're out to get what they want, regardless of what happens to us. And technically, they work for us. So I'm curious, what it looks like 15 days from now, 25 days from now, 45 days from now.
Yeah, that's the million-dollar question. The government has officially shut down. My phone is blowing up with statements from Democrats and Republicans already trying to point the finger and play the blame game so that their side does not get blamed by the millions of Americans who will be impacted by the consequences of this shutdown. The first one, Stephen, since 2019. That was the longest shutdown in history. It happened under the president's first administration. It lasted 35 days. I mean, even if you're not a federal government employee and you think it's not going to impact you, by the way, the nonpartisan Congressional Budget Office estimating that nearly 1 million people could be furloughed, costing the government potentially $400 million. Even if you're not in that bucket or you don't know anybody who's a federal employee, you could still be impacted. That is because certain services will just cease. The clock struck midnight. That means infant and child formula, food assistance for women, flood insurance. The national parks will have some closures. If you're going to the airport, you have to give yourself more time because those TSA workers will be showing up, but they won't get a paycheck. Other services like social safety net benefit programs could also be delayed. So this.
Imagine that. TSA workers already hate their job. Now they're not getting paid. you could just see the problems that this will cause. And I actually decided to look up some of these things, and I found I just chat GPT'd it real quick. And so here are some of the things that will be affected. Obviously, federal employees that are non-essential get furloughed, so they get paid, and that's they'll get back pay. But contractors won't get back pay. Subcontractors working for the federal government won't get back pay. So if you're on a federal, if you're doing federal work as a contractor, you're screwed. You now are officially screwed. And if they owe you money, it's not like they're gonna pay you out and then stop paying you. They're just not gonna give you those funds. So that's another thing that, is important to know. Then you have low income houses and recipients of social services. I think that's probably one of the biggest ones, nutritional assistance, health services, food support. It could face delays and reduced capabilities. For example, the Women and Infants and Children program is at risk if shutdowns last too long. You're looking at people who need these programs to survive. More specifically, I'm worried about Americans, like those are our fellow Americans. And so they got to figure something out quick. Also, immigration, applicants and legal cases. You already know all the shit going on with ICE and immigration as is. Non-detained immigrant courts, visa and permit processing, asylum hearings, and related source services may be delayed or suspended during a shutdown. I guess that kind of speaks for itself. I don't have to say anything on that. But researchers, science and public health agencies like the National Institute of Health and Centers for Disease Control and Prevention may suspend many operations, especially non-emergency or new research funding, reviews, new clinical trials, or public health initiatives. A lot of things are affected. So here's number 7. Local communities and state governments. Local governments sometimes depend on federal grants, transfers, or shared funding. When federal funding is delayed, local services, housing aid, infrastructure grants, community programs can suffer. And that's a big one because I actually have done I've done work based on federal grants, so I know the direct impact that it would have. Now, a lot of programs in the city level, the local level, have the ability to spend their own funds, knowing that they're going to get reimbursed by the federal government. That's usually how it works. The program or the city will spend X amount of dollars. It's then categorized and then it's sent to what would be and for my instance, I work with HUD, so it was the GTR, which is the grant technician representative, I believe is the term. So she would look at all the receipts that I put in, and then she would approve them or not approve them. And so what she approved, then we would get a what would be called a drawdown from the amount of grant that the federal government has awarded us, right? Because you don't get a grant from the federal government and just receive all the funds, and at least not in what I was doing. Maybe there are grants that are like that, but what I was doing for HUD, it wasn't like that. You had to draw down. You have a lot of nonprofits that are intermediaries between local programs and the citizens who need these programs. And so if they can't draw down, or if they don't know when they can draw down, then that's another issue as well that'll hurt not just the nonprofit that's doing the work, but also the people who work for the nonprofit.
This has extremely real practical consequences, and it is exactly why in polling that we've seen all day long, both sides are going to be blamed by the American people. But what we go from here is that Republicans and Democrats need to come together to reopen the government. That's going to be even harder than potentially this back and forth that we've been seeing to keep the government open tonight. I caught up with House Speaker Johnson earlier tonight, as well as Leader Thune, in individual interviews pressing them on what happens next. Well, for Republicans, they're going to keep putting on the floor that clean funding extension, their 7-week plan to essentially extend current funding levels. They're going to put that on the floor over and over again, trying to pick off Democrats. They already picked off 3 of them tonight to try and get at least 8 so they can join Republicans and reopen the government. As for Democrats, who I also spoke to Leader Chuck Schumer, saying he is dug in. Why? Because of health care provisions that he says could lapse, could hike up premiums on millions of Americans. The fight is now, and really this is all about the Democratic base and trying to appease the very voters that they will rely on to win back some ground that they lost in November, Stephen.
They should be locked in a room until they come to an agreement, period. You guys don't want to agree, you guys don't get no food, okay? Like the paid in full.
Make it with a count, make it with a count. That's off. Give me my money. Give me my money. Give me my money.
Come on,
right here, man.
I ain't got it right now, man.
You ain't got it? No ribs.
Nah, come on, B.
No ribs, no rice, no champagne. You don't eat nothing.
That's the kind of government we need. I really think that a lot of these people, first off, they don't care if the government shut down because they keep getting paid. They're considered essential. And two, they're fighting for things that a lot of us regular day people don't really care.
Do Democrats want to prioritize the health care of illegal aliens over a government shutdown? Because if the government does shut down, American
Excuse
employees are going
me,
to be furloughed.
stop it right there. We're not prioritizing. What we're doing is saying simply we want to keep the government open and we want to work with the Republicans and have a bipartisan agreement to keep this government open, and health care is at the top of our agenda.
But aren't Democrats demanding health care for illegal aliens?
Democrats are demanding health care for everybody. We want to save lives. We want to make sure that health care is available to those who would die, but having the help of their government.
So you're good
She's not answering the question. She's obfuscating. Professional obfuscator.
with the government shutdown, even if it means giving health care to people who aren't American citizens?
Well, you keep,
Exactly.
that's what you're pushing on. What you're trying to do is you're standing here and you're trying to make me say that somehow we're going to put non-citizens over Americans. Quit it. Stop it. This is the kind of journalism we don't need.
No, I'm just
you're
asking
divisive.
questions.
No, you're not.
Yeah, no,
you're
that's
being
what-
divisive.
She's not being divisive. She's asking you a straightforward question. That is a very good question to ask, and it's something that needs to be answered. And if you notice, the young lady says illegal immigrants, and Maxine counters with non-citizens. So let's see what he has to say. Let's see if that...
Returning back to Detroit this morning after the Republicans failed to show up in the U.S. House. We got to make sure Americans have the health care that they need. And if that means we got to shut this government down, so be it.
Of course, you can say that because you're not affected by the government being shut down. But if you were affected by the government shutting down, what would you do? Would you want it shut down? I'm willing to bet your bottom dollar you'd say no. So let's see. Holy crap. Hakeem Jeffries regrets going on CNN. Jake Tapper just embarrassed him. Uh-oh. So this is 16 hours ago. Let's see what Jake Tapper did.
Donald Trump blessed it as well.
So let me ask you about a provision that the Republicans are talking about quite a bit. I know you want to talk about, and Democrats want to talk about, extending the Obamacare subsidies, which expire at the end of 2025. But they talk about the provisions, and it's right here, subtitle E, and this has to do with the repeal of healthcare subtitle changes, and specifically what it is. How they characterize it is you want to give health insurance to undocumented immigrants. I understand that's not really an accurate depiction, but what it does do is...
It's a lie.
It's a lie, but what you support does bring back funding for emergency Medicaid to hospitals, some of which does pay for undocumented immigrants and people who don't have health insurance. And also there is this provision, and it's not about undocumented immigrants, it's about people with asylum seekers and people with temporary protected status, et cetera, but about their ability to get Medicaid. So they're non-citizens, they're not undocumented, they're not illegal. Why even include that in a bill knowing that they're going to seize right upon that and use that to message? I understand that
Jake Tapper tap dancing. Okay, Jake. Here's another Democratic leader from the state of Rhode Island, Governor Dan McKee. I've met him. I've had conversations with him specifically about business endeavors. But let's listen to what he has to say.
As your governor, I've made it clear that affordability, particularly in health coverage, is my top priority. A central issue driving the government shutdown is a disagreement that, if left unresolved, could have serious financial consequences for Rhode Island families. Without action, those who go to renew their health coverage through Health Source Rhode Island later this fall could see their monthly premiums more than double.
Now remember, Rhode Island is a sanctuary state,
with some facing increases as high as 340%. I support Rhode Island's congressional delegation as they fight to keep health coverage accessible and affordable.
To who?
Shutdowns create real consequences for real people. We need President Trump to step up and lead, not divide. Instead, we've seen chaos, military troops deployed in streets, attacks on the First Amendment, and now a government shutdown that threatens critical services our families rely on. He must choose responsible governance over political stunts. The American people deserve steady leadership, not fear, confusion, and disruption. In the weeks leading up to the shutdown, I've been meeting with my budget team to prepare. We activated our shutdown protocols across all state agencies, including drawing down as much federal funding as possible to minimize the disruption. We are actively monitoring the situation, especially programs that rely on federal funding like SNAP, WIC, and other health programs. These programs remain stable for now, but the longer the shutdown continues, the greater the risk of disruption. We'll continue to track developments and keep the public informed. Over 8,500 federal workers in Rhode Island are facing uncertainty. Our team at the Department of Labor and Training stands ready to assist those workers and help them access unemployment insurance as quickly and as smoothly as possible.
Our team is following the situation closely and will provide updates as things evolve. I call on President Trump and congressional Republicans to do the right thing, protect access to health care, and end the shutdown.
Very vague, no direct points. Access to healthcare for all or for just American citizens, like Mr. Jake Tapper said?
Good. We're on day 2, unfortunately, of a government shutdown. The President, the Vice President, the entire team here will continue to work and talk to members on the Hill to try and come to a resolution, to try to encourage Democrats to muster up the courage to do the right thing. And we believe there will be a vote taking place tomorrow, and we hope that vote will lead to the government reopening. That's what the President wants to see, and that's what we're working on today. John.
Yesterday, the Vice President, Henry Thrones, by your side, expressed this optimism that he thinks this shutdown is going to be a short shutdown. Do you share that optimism? Does the President share that optimism?
I do. I think we all, that's our hope, and that's our expectation. We know, Democrats know, they are doing the wrong thing by shutting the government down. You can see it when they're answering questions. You can hear it in their voice. There is zero good reason for them to vote to shut the government down right now. They are doing it for political reasons. They are doing it because they want to give taxpayer-funded health care benefits to illegal aliens, which is something the American people resoundingly rejected ahead of the election last year. That's why they re-elected President Trump in a large part. And so Democrats know what the right thing to do is, and it's to reopen the government.
Caroline.
I'm sorry?
Can't even hear the question.
That's probably not a question for me to answer. I think that's a question for healthcare professionals and legal experts to answer.
Get her. Her hand is in the way.
Let me ask you, do you think that illegal aliens should receive Medicaid benefits? Medicaid benefits that go to the most vulnerable people in our country. That Medicaid benefits that were designed
so much better
to help low-income families and Americans in our country. And what the Biden administration did, Gabe, is they allowed tens of millions of illegal aliens from all over the world to come into our country, yes, and they paroled them into the system. And you cover immigration, and you know well, it was a complete abuse of our immigration system, and they slapped a Band-Aid on these illegals. They called it temporary protective status, and then they allowed those illegals from all over the world to get free benefits. And you know who would like free benefits? Hardworking Americans who work their butts off every day, who are living paycheck to paycheck because of the Biden-induced inflation crisis. And there were higher wait times at hospitals under the Biden administration. Is not going to support it.
Should ERs, if a person comes in with a stroke or a bullet wound or is bleeding out, should they ask for immigration status before treating that person?
Gabe, I don't speak for emergency rooms across the country. I speak for the President of the United States, and that's what he believes on this policy.
So his question was, if someone comes into the ER with a bullet wound or an emergency, is having a stroke or something like that, will they be treated? That's a good question. Should they be treated? I don't I think we need to look at the medical system as a whole. The high prices for premiums are ridiculous. I think insurance companies have a grapple on the prices we pay for procedures, regardless of what it is, whether it's drawing blood, whether it's getting regular testing, whether it's, going to the emergency room, even riding in an ambulance is a couple $1,000s nowadays. So there has to be a way and a system that makes things better. And I think removing the cash incentive, right, the profit structure of these companies is one way to go. And without removing that, there's always going to be high prices, which means if there are high prices, that means you have to pick and choose who gets coverage and who doesn't. It's not something that I'm proudly say like, yeah, I'll screw those people, screw whoever that is. No, of course not. It's easy for me to say I have healthcare.
Nancy.
Follow up on that. If there is this one provision in the Democratic proposal that the White House disagrees with, what's to stop you from negotiating over other provisions where there may be some common ground?
We haven't wanted to negotiate. We just want to keep the government open. That's been the Republican and the Trump White House position since the very beginning. We wanted to pass a clean continuing resolution, we still do, to keep the government open, and then we can negotiate on all of these policy matters. It's the Democrats who injected partisan politics into keeping the government and the business of the American people open.
Republicans do this when they're in the minority too. They see an opportunity to gain some leverage and have a negotiation. Why is it okay if Republicans do it but not when Democrats?
Democrats have voted for the clean continuing resolution that Republicans introduced 13 times in the past. 13 times. They voted for it as recently as March. And now all of a sudden they are shutting the government down and they are holding our country hostage over a partisan political matter that the vast majority of the country disagrees with. And they know it's so unpopular that they're now running away from it. I saw some senators on television this morning saying, we don't want to give health care benefits to illegal aliens. Yes, you do. Roll the tape. You can see time and time again, Democrats have supported that. They've voted for it, and they did it under Joe Biden, and we stopped it. The president stopped it with the passage of the One Big Beautiful Bill. And now
that's a good point. And somebody jumped in the chat, said they're trying to screw us all. We need a better system of government. I don't disagree with that, but how do we achieve that system? Are you suggesting we tear it all down and build it back up? Because I think the discrepancy that nobody thinks about is the part of tearing it all down and building it back up. That space, that spectrum there is a very dangerous space to be in.
Now they want to undo the president's very popular policy to ensure that taxpayer-funded health care benefits only go to tax-paying, law-abiding American citizens.
Can you give us an estimate on the amount of federal workers that the Trump administration wants to fire during the government shutdown? Are we talking hundreds? Are we talking thousands?
Look, it's likely going to be in the thousands. It's a very good question, and that's something that the Office of Management and Budget and the entire team at the White House here, again, is unfortunately having to work on today. These discussions and these conversations, these meetings would not be happening if the Democrats had voted to keep the government open.
President said today he's meeting with the budget chief, Russ Vought, to talk about which Democrat agencies he recommends be cut. What agencies are on the table for that conversation?
Those conversations are taking place today. I won't prejudge them. I won't get ahead of them.
Even anything that's potentially considered right now. When he says Democrat agencies, what is he referring to in the federal government?
Look, we're going to look at agencies that don't align with the administration's values, that we feel are a waste of the taxpayer dollar. And look, unfortunately, these conversations are happening because we don't have any money coming into the federal government right now. And so the president wants to be a good steward of the American taxpayer dollar during a time when our balance sheet is looking very grim because the Democrats chose to shut the government down.
That's crazy. He's gonna go ham on day 2, and knowing Trump, he wastes no time whatsoever. So you can only imagine what he's gonna cut. Especially now with the government shutdown, there's a lot less restrictions that he has as far as being able to say, yep, let's cut this, let's cut that. So he can just go ham, kind of like he thought he would go ham with Doge. I don't know what's gonna happen, but you heard it here first. The next couple weeks are gonna be good,